3 times as many people die here because they abuse alcohol than die on our roads. For the first time, an alcohol liaison nurse has been appointed in Craigavon to support hospital staff and to help tackle this growing problem. In a moment, we'll be speaking to Dr. Alan Stout from the BMA, but first, our correspondent Jane Lockery has this report.
Alcohol abuse costs Northern Ireland £900 million every year. Between 2003 and 2013, there were over 2,800 alcohol-related deaths, compared to 962 road deaths in the same period. To put this into context, it means that 3 times as many people die because of alcohol abuse than die on our roads.
Hello, Jessie, how are you? My name is Andrea. Okay, I'm the alcohol liaison nurse.
Here at Craigavon Area Hospital, an alcohol liaison nurse has been appointed, the first post of its kind in Northern Ireland, to try and help tackle a problem which claims lives and wrecks families. One of the first people Andrea Judge helped was Raymond, a chronic alcoholic who has in the past lost his home and his business because of his addiction. He had his first drink when he was 10.
I couldn't control drink. I was a bad drinker. I got violent at times and drunk to excess, drunk till I collapsed, till I went unconscious.
How important was the alcohol liaison nurse to you?
Oh, very important. Saved my life. Saved my marriage as well.
How?
I was able to get off drink. I learned a lot from those people when they came out to the house to talk to me about alcohol. Really, that I didn't know before. They opened up my mind to it, you know.
What would have happened if you had kept drinking the way you did?
Well, the doctor told me I would die in a short space of time.
What did he say?
He said another drinking session would kill me.
Government figures show the number of alcohol-related admissions to hospitals here is increasing. In 2012, there were almost 9,500. Last year, over 10,000. That's a rise of almost 10%. And admissions increase at weekends.
A lot of the times when people do come into hospital, they're at their lowest. They've maybe fallen, they've fractured limbs, they've come in with seizures related to alcohol withdrawal. They're confused, and they're at their lowest. And at that stage, I'm hopeful that they're ready to engage with myself.
Would many patients deny they have an alcohol problem?
They do, yes. They do. On a daily basis, I see people that deny that they have a problem and don't see it, but their families maybe see it.
Funded by the big lottery for 3 years, Andrea works closely with a consultant psychiatrist. With the Health Minister revealing the health budget is short by £140 million, she's concerned the already underfunded addiction services will suffer.
Well, mental health, we consider ourselves the Cinderella service. However, the addiction service is almost the Cinderella of the Cinderella service. We know that for every £1 invested within substance misuse services, we do reap rewards in the longer term, both in terms of reducing A&E admissions but also hospital admissions. The aim would be that if we were able to engage people in therapy, they wouldn't be presenting in that particular way. The National Treatment Agency would indicate that an investment in an alcohol liaison nurse can reduce A&E visits by a figure of 97 over a year, and also hospital admissions by a figure of 54, and that's a saving above and beyond the costs that were for that alcohol liaison nurse.
Dr Gilmore believes there are many reasons for alcohol addiction, including social deprivation and cheap alcohol. She knows families are suffering.
The impact of alcohol in the family is one of our greatest concerns. We know that there's a social impact from alcohol generally. We know that it's associated with violence, domestic violence. We know it's associated with child abuse and child neglect, and also in work absenteeism. But for families specifically, we are offering services to help support those individuals, because they're the people who know that person best. They're the person who are supporting them.
Raymond's convinced alcohol should be treated like a dangerous drug, and every hospital in Northern Ireland should have an alcohol liaison nurse to help people conquer their addiction.
It's very important. It's It's very important. There's a large addiction in this country with alcohol, while people notices that are not. And they need help, then people, they're sick.
The problem of alcohol misuse is clearly growing, but with the health service already severely stretched, many will wonder just how long hospitals will be able to cope with the volume of people seeking help. Jane Lockray, UTV Live Tonight, Craigavon.
Joining me in the studio, Dr. Alan Stout from the British Medical Association, who's also a GP. In your experience, how serious a problem is alcohol?
It is a serious problem, and it's actually becoming more of a problem. We see it on the news of patients and people with acute intoxication going to ED units, A&E units, but also the long-term effects of alcohol as well, which we see in practice on a daily basis, are becoming more and more acute.
Who do you blame for this?
Well, I don't think there's necessarily blame to be attached, but I think it is a society problem in terms of ease of access to alcohol, and also I think there has been problems in terms of education and support for.
But whenever you talk to somebody and you tell them maybe, you know, that they're drinking too much, are they going to listen or not? They do. I mean, certainly raising awareness and the education outside of surgery and outside of the medical environment is important. So people do listen, and sometimes people don't realise that they have a problem, so the first person to actually bring it to their attention can be very important and can actually make quite a significant difference. What do you make of this initiative in Craigavon, where a nurse will actually sit down and talk to somebody on a one-to-one basis? Yeah, I think that is a good initiative, and I think it's an important initiative for two main reasons. One is that it actually dedicates time to the problem, so trying to deal with a problem just as a one-off can be difficult, and that problem then tends to recur. So trying to deal with the longer term issue with that and the stopping the problem recurring, I think is very, very important. The second important thing with the initiative is that we know of the pressures on the health service as a whole at the moment, and to try and take that particular group of patients away from mainstream A&E and mainstream hospital, and hopefully for practice as well, can actually free up time of the other clinicians to deal with other cases coming through. Health budgets are always under pressure. I'm just wondering if money could be found, could this be rolled out to other hospitals? Yeah, I think it is, and I think it's also an example of an invest to save, because ultimately if you can deal with the problem and you can make a sufficient improvement long term, that's going to save the health service money down the line as well. Is there any particular age group we're talking about here? I think it affects all age groups. Again, the ones that hit the headlines tend to be the younger age group, but we've also got to be aware of the long-term issues with alcohol, which tend to affect middle age and the older age, and that would be the cancers and the liver problems and so on that affect people down the line. So anything that helps to reduce intake and reduce those risks down the line is going to have a... Finally, do you think that you're getting that message out there of the risks of alcohol? Slowly, and it takes much more than just the GP surgery or an alcohol liaison nurse. It needs a protracted public health campaign. It needs to be constantly brought to the attention, and it also needs political intervention as well in terms of access to alcohol, pricing and other measures like that. Another debate for another night, but for now, Alan Stout, thank you. Thank you.